And so these are the most common things that people mean when they tell you that they're dizzy. The first one, and these are not necessarily in order of prevalence or how common they are, but the first one on our list is ataxia. So ataxia has nothing to do with a sense of the room spinning or a sense of getting lightheaded. Ataxia is, like the slide says, an inability to maintain balance. It's an inability to maintain a steady gait. So people have ataxia when they're walking. They don't usually experience it when they're sitting down, they don't like, or when they're driving or when they're laying down. So right off the bat, when somebody comes in and tells you that they are dizzy, one of the things you want to ask is like what they're doing when this occurs. The patient who is ataxic, they feel like they can't walk a straight line. I mean, like they just feel like they try to walk from point A to point B and start listing in one direction or the other, and then sometimes will have to sit down and sort of collect themselves. That's consistent with ataxia. On the other hand, sometimes patients say they're dizzy when they actually get very lightheaded, and what they're truly experiencing is near syncope. Near syncope, it is a vague sensation, and so there's several different descriptors that you could use to identify it. But one of the best I've seen is this sense of sinking. They feel like they're sort of, like almost blacking out, or the world gets fuzzy, or sometimes we'll describe what almost sounds like a sense of derealization or depersonalization. They just sort of feel disconnected and um, sinking. I like the word sinking. So I think you know what I'm trying to say, and you may have a different descriptor for it. But near syncope, this sense of sinking has very different causes from ataxia. And this is another one of those right off the bat questions. And then, of course, there's vertigo. Probably near syncope and vertigo are the more common things that people are talking about when they come in and say, I feel dizzy. But vertigo is pretty easy to distinguish because vertigo is accompanied by a sense of rotational movement. And again, patients don't usually say, I'm experiencing rotational movement. What they say is spinning. Either their head is spinning, or the room is spinning, or if they're really unlucky, both things are spinning. But vertigo is usually described as a sense of something spinning, and usually accompanied by significant nausea as well. Although the nausea can happen with almost any of these things, so it's not really a good co-symptom to help you rule out causes. It's the spinning thing that's really significant. And then syncope is an actual loss of consciousness. And I know you know it, and I know it, we all know it, but sometimes patients use the terms incorrectly. It is not unusual for someone to tell you that they passed out, and then you start thinking they had a syncopal episode, and your diagnostic trajectory moves down the syncope trajectory. And then when nothing makes sense and you go back and revisit the history, you find out that they didn't actually pass out. Like maybe they thought they were going to pass out, or they felt like they almost passed out, or well, they just had to sit down. Then things might change a little bit. So the idea is to figure all this out before you move well into a diagnostic pathway.